So today's topic is gastrointestinal endoscopy, as well as the interventional procedures that can be done. And myself, Dr. Shagun, and I'll be taking this. It's a theoretical lecture, but I'll try to keep it as practical and as relevant to the clinics as possible. And these are my contact details in case you feel shy discussing anything during the class. You can always reach out. And so yes, just like always, these slides completely belong to me. I hold all the rights to them. They need to, in case they are being projected anywhere, the content is being used elsewhere, my prior consent needs to be taken, as they are solely my property, my right. I've worked hard for making these slides for your benefit, so let's make it count. So we'll be covering the diagnostic and therapeutic advances in GI endoscopy, as well as cancer detection, me myself working in the department as well, and the minimally invasive management. Here, minimally invasive does not mean laparoscopic, it means endoscopic. So the objectives would be to understand the role of diagnostic and therapeutic endoscopy and review the common interventional procedures, which could be ERCP and S-based. ERCP is endoscopic retrograde cholangiopancreaticography, and EOS is endoscopic ultrasound. And we'll be able to appreciate endoscopy's role in detection of cancer as well as its management. And after the class, you should be able to describe the indication and techniques of diagnostic and therapeutic endoscopy. We'll be discussing them in detail and recognize the principles of ERCP as well as S-guided intervention, and then apply these endoscopic strategies in early cancer detection, as you'll be able to do it in the clinics later on.
Cancer detection involves identifying abnormal cell growth early through screenings, imaging tests, and biomarkers, enabling timely diagnosis, effective treatment, and improved survival rates, while reducing the burden on healthcare systems.
Just a bit about history. So the timeline goes like 1954, there was a Hopkins model of a flexible fiber imaging device. Before that, endoscopy was a challenge. You could view only up till the posterior pharyngeal wall, or could just do a proctoscopy. But once a flexible fiber imaging device was developed, so it's a long tube like we used to study in our PMT times. So it's a long tube made up of fiber. The light can reflect multiple times and then illuminate, and you will be able to see the image that it generates. 1958, there was the first flexible fiber optic gastroscope developed, so the tube can now reach up to the stomach in 58. In the 60s, there was a charge coupled device added with a digital electronic image, so everything could be projected upon the screen and there was no ergonomic challenge. ERCP came in the 70s, and in the 80s came the interventional endoscopy, where they just added one more port and you could pass instruments through them. 1996, with the rising incidence of cancers, we needed to palliate the patients. You can't just operate on every one of them. Just to reduce the morbidity of such palliations, self-expanding metallic stents were developed, and the latest development was endomicroscopy, which delivers histological mucosal definition. So while you're doing endoscopy, the mucosal definition is so enhanced that it is as good as taking a biopsy and then examining it under the microscope.
Rise of endoscopy revolutionized medical history, evolving from primitive tube inspections to advanced fiber optics and digital imaging. It enabled minimally invasive diagnosis, improved surgical precision, reduced patient recovery time, and transformed healthcare into safer, more effective practice worldwide.